I also want to mention the last team that just went on, Georgetown. They're about to finish our PhD pretty soon, right?
Am I going the wrong
George
way?
Washington. So they're local. Clap it up for them again. They're doing all this and their PhD at the same time.
Yeah. Okay. Okay. Okay.
Yeah,
That's it. Okay.
you got 100 slides up here. I'm glad we put y'all on a time limit.
Yeah. Sorry. Okay. Here we go. All right.
Let me make sure you're in the right angle.
Yep. So happy to get connected with you. Hello. Hello. My name is Isis Ashford. I am the co-founder and COO of Greens Health, and we are reimagining healthcare to focus on complex chronic conditions into culturally relevant self-management practices that focus not only on the patient, but the family as well, to reduce hospitalizations and complications. And now I want to share with you a member story that you're probably familiar with. Let me introduce to you Denise Moore, who's 82 years old and has just been admitted to the emergency room. Her daughter Ebony was with her every step of the way, getting world-class treatment from the emergency room department. She was admitted because she recently broke her arm, and through many other or a series of conversations, the physician diagnosed her with Alzheimer's. This was a huge blow, not only to Denise, the patient, but Ebony, her daughter, who is currently already overwhelmed with helping manage her diabetes as well as hypertension. And so now with this new diagnosis of having Alzheimer's, it's a new medication, a new regimen, and Ebony is just, again, feeling very exhausted and drained from the whole experience. And the physicians do their best to communicate what the protocol will be, but as Ebony goes home, she realizes her mother is alone. She lives by herself, and she currently only relies on her and public transportation to go back and forth to pick up prescriptions, doctor visits, get groceries, and all the other things. And so as Ebony is trying to figure out what to do next, she's left with a couple of options. And again, where Ebony sees the challenges, Greens Health sees the opportunities. She can use a platform like ours that performs several different services, from chronic care management to perform the medication education and medication reconciliation, the remote patient monitoring to manage patients and monitor patients in between visits, medical nutrition therapy, case management, but what's most important is the caregiver education. Because Ebony is not a nurse. She has no idea how much to administer to her mom or what even these medications mean. She has this paper, but no constant reinforcement. And so with the Greens Health team, the emergency physician refers Denise to our program, and we dive in not only focusing on Denise, but up to 3 caregivers and best self-management practices, because we appreciate outside of the clinical visit, there needs to be that constant reinforcement and education of best self-management practices. All of this leads down to better HEDIS measures ranging from 80% statin adherence or achieving the 80% statin adherence, better glycemic and blood pressure control, and transitions of care. And so we know that this works because we've piloted this intervention in our latest pilot, where 76% of our population within 30 days had 100% medication adherence, and we had an 84% engagement in our SMS text responses. And so today we're learning and trying to figure out how do we become an in-network provider with KP to align ourselves with the home-based initiatives that you guys are already leading in. And so that is it. Thank you for the time. Yes, I'll go. Yeah, no.
Do you help with all programs? I'll just use myself for an example. My great grandmother was alive. I had similar situation here.
Yeah.
She actually had a quad bypass.
Mm-hmm.
So it wasn't diabetes, but along with that, then it becomes you have to feed them a certain thing. You have wound care. You have mobility care, you have, like you said, the pain management, because you can't just give them medicine when they say, ow, I hurt.
Yeah.
Then you had the Alzheimer's. We also had
Mm-hmm.
home sterilization, getting a bed, all those things. Do you connect the dots in that kind of a case? Is it every kind of care, or is it just
Yes.
that's cardiac, cardiac, but she also had the hypertension and all the other things going on.
And what was your name again? You've been asking some good questions.
Carlene.
Carlene. Thank you, Carlene. Thank you, Carlene.
Yep, excellent question. And that's why we deploy the case management to address all of those non-medical issues, as you mentioned, feeding.
And then my mental health.
Right,
Come on,
right.
somebody.
We don't even,
Come
yeah,
on.
which is why our approach is taking a specialized intervention to the caregiver, because we realize they are the backbone and the true support to the actual patient. And so by interacting with not only the patient but the family, we get 2 points of reference, but we can also engage with up to 3 caregivers. But we also have our nurse and MD to also monitor and address all of the other medical issues you were talking about.
But you would have helped get a home health nurse
for our care manager, our case management. Yes.
Break in the coverage that I see is that when you need a home health care provider, they all of a sudden start digging into, well, how much money do you make and how much can you afford? And that, like, we literally had to sell everything my grandmother owned before they would come into the home.
Yeah.
Was your grandmother on? Did she declare hospice or?
Yeah, we did hospice at home, though. We didn't want her in one of those facilities.
So one of the things, and this is
I think explaining the options too.
This is one thing. Is a great story for KP. I don't know if it's a benefit. This is a great story, so it's something that should be a benefit. Is not only you talked about the coordination of home health workers, that should be a benefit, CPT code somewhere, but also you mentioned something that is near and dear to us is we're going through it personally, is the depression and the grief that you go through.
Yeah.
So in most benefits, there's some type of guidance counselor that you can receive, and hopefully KP, you kind of, that's a part of the in-network benefits that is available. I just want to address that and say it out loud because I think that's a point that really matters.
Because not only my grandmother, I'm younger,
yeah,
but then I've got a 70-year-old mom, like she can't do all that. So I mean, it was just a compounded scenario. And if you think about families as a whole, that's usually how you rally together to try to take care of someone. But it shifts, who's sleeping, who's not, who's up.
But even who's the project manager of that?
And that was.
So it goes back to like our case management and doing the care coordination. But there's a gentleman in the back. Do you have to tell the question? I think he's talking. Okay. Bill.
Bill.
No, so we don't have access to the information. All of the information has been through independent pilots. First pilot was with a diabetes camp, and so we don't have any hospital or claims data to go after. But that's our next pilot goal. Yep. So we measure success through our